All right, you're good to go.
All right, welcome to the Board of Health meeting, 3 o'clock, August 12th. We are going to start with public comments at this time. Rebecca will unmute you as to your time or your turn. I'm asking everybody who's here to keep the comments to 5 minutes or less. We actually only talk, try to keep it to a minimum. And let's go ahead, Rebecca, start it off.
All right, so the way this works is if you would like to speak, you just raise your hand. Or if you don't have anything to say, you don't have to. But everyone's muted until I can unmute you except for the board. I don't have anybody, so you guys can just start your meeting.
Okay, Hillary, why don't you start digging right into what we think you should be doing? We got to tackle the pay as you throw. You want to do that?
Yeah, we can take pay as you throw first. So when we met a couple months ago, we decided to sort of put a hold on the use of the purple pay as you throw bags during the pandemic because we thought it would be easier for folks to get rid of their garbage if they didn't have to continuously go to the store and get purple bags. It cut down on interaction among staff at the transfer station and the public, and it just seemed like the right choice. So that is set to expire on Labor Day. So while we're still in a pandemic state, I don't know if the board wants to consider continuing with the purple bag ban for another few months or getting back to purple bags. And the transfer station, Mike doesn't care either way. He just wants to know so we can start to put the word out that we're going back.
Okay. Janet, Nick, you guys got any comments upon it?
Well, my impression is that there are going to be more people staying here through September. And I think they're even extending the beach registration and all that. But so yes. I'd be inclined to continue for at least through September and see how things are going.
Okay.
I just think there are going to be more people around and spending more time here. I'm even anticipating throughout much of the fall there may be more people here. Well, that's something we'll have to see. I don't know if we have any ideas about that, Hillary. About second homeowners are going to be staying for longer periods, renters, staying for longer periods.
Yeah, my guess is that we will have more folks in town with schools, some schools being shut and, right. People finding it easier and a little bit safer to live out here. So I think we will have more people around.
Right. Yes, I might be inclined to continue then for at least through September and then reassess maybe.
Okay.
Right. I also feel that the objective of why we held it is still holding, if you know what I mean. In other words, that hasn't changed. So the impetus to change it back again to purple bags isn't really there yet. So I agree with Nick that we should continue it on till September to decrease the need for socialization and to try to keep our social distance as much as we can.
Okay. Well, all right. Then can we decide maybe we can let the transfer station know that we're going to go through September, but can we pick October 1st as a go day to restart the bags?
I think that sounds good.
Nick, what do you think of that?
October 1st is a Thursday, just for frame of reference here.
Well, I was just picking a beginning arbitrary day.
Yeah, no.
October 1st, you can say, yeah, purple bags again. Nick, what do you think of that idea?
I guess it's reasonable.
We could always.
I was going to say we can rethink this at when's our October meeting? Is it
our October meeting would be October 14th.
Well, we could always do an arbitrary date of starting back on October 1st.
Okay.
And if we want to adjust this at our September meeting, we can do it at that time.
Okay.
But I think we should start the process of getting ready to get back into the purple bags.
Okay.
All right, I can agree with that. We can reassess as we go along 2-3 weeks from now. We'll see what's happening.
Yeah. Okay. So, Hillary, do you need anything else from us?
Did you make a motion?
Janet, can you make a motion?
Sure. I so move that we continue on with the holding of purple bags until October 1st, 2020, at which time we will reevaluate the situation. I'd also like to just maybe make a suggestion that at that time we have a bit of a financial picture of the pros and cons, so we can make that determination based on some facts also, aside from just COVID.
I'll
I got a
second,
motion. Nick, you got a second? All in favor?
I'll second that, yes, I'll second that.
All in favor?
Aye.
Okay, the next thing I wanted to just touch briefly on was our COVID pop-up clinic, which was held on Tuesday, July 28th. And we had registered 136 people here in Wellfleet. And most of those folks work in our restaurants. They don't all live in town. And pretty much all 136 of them were tested either at the pop-up clinic, or a few folks that got left out of Cape Cod Healthcare scheduling got tested here in town at Outer Cape Health. And out of all of those people, we only had one positive test, which was one person in one restaurant that doesn't even live in Wellfleet. So I think that's pretty promising surveillance data that our restaurants do not have individuals working in them that have COVID. And I feel fortunate that we got to work with the towns of Harwich and Dennis and Brewster and Eastham on this clinic, because we wouldn't have been able to do it alone. The clinic was held in Harwich. Cape Cod Healthcare did the scheduling. Barnstable County Health and Environment helped out, and the fire department from Barnstable also was there to do some of the nasal swabbing. So I look at that as actually a giant success among all the other things going on. So that, I think that's a really good positive thing that we've done, and the results were great. So that,
Good.
the clinic,
And the contact tracing showed an asymptomatic positive, Hillary?
completely
With no
asymptomatic.
contact?
Completely asymptomatic. The
Good.
individual had traveled to Massachusetts from another state, from the state of New York, within the last 2 weeks. So,
Okay.
So that was good.
Thank you.
Well,
Excellent.
that's fantastic. That's fantastic news.
Good job.
Thank you. The other thing we're doing is actively, continuing to follow up on complaints. Today alone, we're following up on 3 complaints at 3 different establishments of crowding without social distancing and lack of mask wearing at 2 of the establishments, and 1 establishment had an overabundance of people eating in there, potentially seated too close. So those are the 3 we're following up on today. Yesterday, we took in a big complaint about Marconi Beach, which we forwarded to the Seashore to handle. So it was nice to kind of give 1 complaint away.
Right.
Other than that, we're getting a couple complaints in about the travel advisory, and we have an email for folks to file those complaints with at the state, because the state has not yet given us the list of people that are traveling to our towns that are on quarantine, which they intend to do. So that's interesting also, but we don't have that information yet.
How accurate do you think those lists are going to be?
Only as accurate as the people that actually
Oh,
self-report. So it comes down to self-reporting, where travelers are supposed to self-report themselves as travelers. And if they don't wish to quarantine, they can come in with a negative COVID test. So even if they have the negative COVID test, I believe they're still required to register. So.
All right.
Hillary, can I ask just about the asymptomatic case,
Sure.
positive test? Where does that get reported? I mean, is that a case for Massachusetts or New York? I don't know how that
Yeah,
works.
no, that gets, the individual lives on Cape Cod, just not in our town. So it is a
Oh,
a case.
Cape Cod,
It is a case on
Barnstable
Cape
County.
Cod.
Okay, good. Okay.
Yeah. Mhm.
Okay.
And most people from our clinic, I'd say there was only like 2 small handfuls of folks that had out-of-state addresses. So
Okay, that's good.
Okay, good.
most of the folks working here in our restaurants have Wellfleet addresses. So
Well, that's wonderful news to hear that they were all coming back negative.
yeah, the other thing that's kind of exciting that we're working on, the town of Truro, Emily Beebe and I are working with Outer Cape Health, because we had so many problems with the scheduling of the pop-up clinic that we have begun meeting weekly with Outer Cape Health, and we're sort of committed to working with them to get more testing in town and on the Outer Cape, because I'm sure you've seen that the Stop the Spread sites are located. The closest one is in New Bedford or Taunton. They're really focused in Revere and north of Boston, because the case counts on Cape Cod just aren't high enough to have one down here. But there are a lot of impediments to getting asymptomatic testing if you're not a close contact. So when you call up Outer Cape Health, for instance, and say, I'd like to get a COVID test, the first thing they're going to ask you is, are you a close contact? And truly, if you're wearing your mask everywhere you go, you're never going to be a close contact with anybody except your family that you're living with. So they can't then even offer you a COVID test, and they're not set up to even offer you a test if you're willing to pay for it at this point in time. So there's a real difficulty with getting folks that are asymptomatic or that just want to have a test to have the PCR test, which is the test that we obviously want people to get, not the rapid test that's offered at Carewell. So we've been working with Outer Cape Health. We finally made some headway the other day, and we're able to talk to Ron O'Connor, who's the director of local public health for the state. And we pushed our case pretty hard because I think you guys know that schools are going to be opening on the Cape.
I'm going to ask about that.
Low, and we're not set up to have any type of testing clinic. There's no prospect of us even like having enough supplies to do that. And once we start seeing sort of potential cluster outbreaks in schools, families are going to get nuts, and people are going to just want to get tested. They're not going to care whether they're a close contact or not. So there's a lot of fear out there, I think, in families and in teachers right now about COVID and about returning to school. So we are trying to also push with the state that our communities are fairly unique. Our people aren't going to go to Hyannis to get tested. Like that just, I mean, they would if they had to, but it's an inconvenience. Not to mention a lot of our young families also have very close contact with those that are in the older age bracket that we're concerned about. So we're mixing generations here in a way that might not be the same because of the dynamics of Cape Cod and the cost of living. So we're trying to sort of push the issue and get something set up sooner rather than later, so we don't have to be so reactive and we can be proactive and work as a region to bring this to the Outer Cape. So that's one of the other things that, you know, we're working on that doesn't take center stage, but I think pretty important. So
Hillary, I have a question. As far as testing persons who are asymptomatic without contacts, is there any model of what they're doing in order for people to travel? I.e., someone wants to come somewhere that says you must have a negative COVID test for 72 hours. Is there any area that we know of that has addressed that as far as the testing?
So from what I understand, those people, from what I understand, those people go to Carewell. So that's why you see the line at that place, like wrapping around the parking lot to Stop and Shop.
Okay.
And apparently, I understand, I don't know if this is true or not, that they offer both the PCR test and the antibody antigen test. And from what I've been told, the costs are the same, but the PCR test has a longer turnaround time. So sometimes by the time they get the results back, the 72 hours have come and gone.
Yes, I see. Okay, thank you.
So that's the other piece that's an issue.
The other question I have, I haven't watched to see if Governor Baker's press conference was on today yet, but he was supposed to identify today, Wednesday, the 12th, the cluster areas in the state that he was concerned about, that he was going to mobilize resources and enforcement support to. Has anything happened with that?
No, I
Not yet.
haven't heard him talk yet, but if you look at the map, I'm just going to see if I can pull up that map, the color coded map.
Yeah, it's available.
Yeah, I know it's available.
Yeah,
I think he's focusing his efforts to the red areas.
Okay.
And we are not there.
We're not there. Yeah, I realize that. Okay. I just didn't know if that announcement had been made. Thank you.
Okay. Well.
Oh, Hillary, when this,
what else we
who's
got?
going to be
Okay.
responsible for making sure the school's open in the right way? Technically.
Who's going to be responsible? So that falls under the guidance of DESE, which
Okay.
is the Department of Early and Secondary Education. And it's interesting because their guidelines differ slightly from the DPH guidelines that we've all been
Right.
operating under, mainly for social distancing, which I think
Right.
is so interesting.
Right.
They're trying to come to get on the same page about what that right distance is, because the DESE guidance is a smaller distance than the 6-foot distance
Right.
that we're working on. And we had a meeting last week or the week before with the NOSIT nurses. So the health agents and the NOSIT nurses all got together and talked, because, you know, it's just, there's so much fear out there, and, you know,
Right.
and it's really difficult to sort of combat that at this point, because,
Right.
you know, people are seeing like the hallways of the schools in Georgia, and obviously that's what Massachusetts is going to look like. However, we have all these other regulations in place that are going to prevent that from happening. So it really has to be collaborative. And so the county is going to be putting on a webinar actually in the next week or so to try and target the teachers and the school nurses with the county nurse, a doctor, some REPC members, and try and sort of get some right information out
Right.
there.
So
Yeah,
Hillary, I actually have a question for you. Is NOSIT school system, are they allowing parents to make the choice of whether they go back to school or whether they do remote learning?
Yes.
Yep.
So every
Okay.
parent has the choice of whether they're going to send their kid, you know, remote or in-person learning.
Okay. And do they have like numbers of when that's going to, what the numbers look like yet or not yet?
So it's my understanding that they've done maybe a survey, a brief survey to see
Yep.
who wants to go back. And the interesting thing is that the families that choose to homeschool or remote learn, I guess is the technical term, not homeschool, but remote learn, they can then at any time decide to go back to the in-person model.
Right.
And then they have to be allowed back to the in-person model. So every time we get groups of kids going from the remote learning to in-person learning, you kind of have to retool everything again.
And they don't have to wait for the end of the semester. Like I know
No.
Monomoy, they said, you know, we have the choice, but they can't come to in-person learning until the end of the first semester.
Yeah, no, I think NOSIT has said if they want to come back, we'll get them back. And I feel like it's about a 3-week lag time,
Okay.
you know, to get prepped. But imagine how difficult that is for the school to
Right.
kind of continuously retool, reset
Me
up.
too. Yep.
Yeah. But that's what it's looking like.
Okay. Do we have anything else on our agenda for today?
I think that was all that I wanted to cover, unless you guys have anything else.
Janet and Nick, you guys got anything you want to say?
Hillary, is there any update on active cases in Wellfleet?
Active cases,
Up
just
there
the
was two?
one.
Oh, just
Just
one?
one.
Okay. Okay.
Just one, 2 dropped off, and now we have just one.
Okay.
And you may have heard of some other cases in town, but folks are just working in town, not living in town.
Is that the, like Mass Appeal? Wasn't there something at Mass
Yeah.
Appeal?
Exactly,
Okay.
yep.
Okay.
And I know Mass
Chief
Appeal-
Polly
What's
has
I,
his
did
hand
I
up.
make a mistake mentioning the place?
No, it's okay. Mass
okay.
Appeal reached out to everyone that was in their establishment on that
Okay.
particular day and let them all know, so.
Okay.
Okay.
Chief
Chief
Confident.
Polly has his hand up.
Before we go to the chief, Janet, do you have anything you'd like to say?
Not right now.
Okay. All right, well, then we can go to the chief. Like I said, I'm asking everybody to keep their comments underneath 5 minutes, okay?
Oh, that will not be a problem, Mr. Chair. I just want to thank you for recognizing me. I just wanted to give you just a brief shout out to Hillary. She has done a fantastic job in the last 5 to 6 months. Hillary and I talk at least once, if not twice a day, and often on the weekends. And she's totally dialed in with our department. And I think, she's done excellent work to keep us all informed and strategies with respect to compliance, enforcement, education. I know the board is aware of her talents and how professional she is. I just want to let you know from another department's standpoint that she is definitely doing an excellent job, and I thank you for that.
Thank you, Chief.
Yay,
Thank you, Chief.
thank you.
I think we all agree with your sentiments.
Can I ask the chief a question, Ken?
Sure, go right ahead, Nick. If Chief.
Chief? Yeah, no, I'm just curious if he's at all concerned about our population possibly being quite much larger than usual for the fall. You know, as far as burdens it may put on the department, trying to respond to all that you usually do, and the COVID itself, and but with who knows how many more people here. Is that an issue you think at all?
It is an issue, Doctor. And yesterday, I'm sorry, the day before was an anomaly, but we had in the course of 3 hours, we had eight calls. Six were all rescues that required transportation to Cape Cod Hospital, and 2 were fire related. We're seeing an uptick in calls as we normally would this time of year. We understand that. We're prepared for it. But I'm also down 2 positions right now, so that's a challenge. You roll the COVID into it. I am of the mindset that this fall is going to be an extended summer season. I think we're going to see that with the weekly rentals. We're seeing it with real estate agents that we interact with all the time. So I think if, September, October roll into some real nice weather, we're going to have a long shoulder season with a lot of people here, which is, good for the economy. And I support that completely, but it's just going to extend our need to be vigilant and to be really, really on top of this. So, as I said, we're having daily conversations, if not twice, with the health agent, just to make sure that we're all on the same page. So, I do see us being having a steady fall season.
Okay. Yeah, that was my concern. Okay.
Okay. Thank you again, Chief. Rebecca, does anybody else have any other statements?
I don't see any hands up, so I think you're good.
All right, then if there's nothing else to be talking about, Hillary, I probably would like to ask for a motion to adjourn the meeting. If there's nothing else.
Oh, can I just ask one other thing to Hillary? Sure. I won't keep you too long. Hillary, do we need to post or say anything about West Nile and Triple E on our website? Do we have anything posted about that? I know it's not a huge risk, but it is the season, has been.
You're muted, Hillary.
Oh.
Sorry.
She already left?
No, I'm here. We usually put the information up when we start to get notice of Tripoli and West Nile on Cape Cod.
Okay.
So it's close, but it's not here yet.
Okay, now just curious how we relate to that. Okay. And one other thing, just for future business, this is something that I think I mentioned way back about the relay program for the shellfish, with Nancy. Program that we work with the Division of Marine Fisheries, and they bring shellfish from, I think it's Taunton River, to clean out here. And I've had a bunch of people asking me how safe it is and why are they doing this. And I thought it'd be reasonable for us to know about it and have either Nancy come. She said she can bring the fellow from DPW who actually monitors or manages the program, but some kind of information for us to know, so we can kind of dispense that when asked about the safety of the program. It's just something that we should know about, I think, as the Department of Public Health.
If I could just
reasonable?
Speak to that, Nick, if I could speak to that. SPAT, the SPAT organization, Shellfish Promotion and Tasting, has financially supported that shellfish relay. And we have asked for success data before we made another contribution, and it is readily available. So Nancy has it. It shows it would satisfy anyone who was curious about the safety or the effectiveness of the program. And we asked for that before we, at a second time in a second year, gave the Shellfish Department extra dollars to do it. So it is there. let's say,
Some-
let's have Nancy bring that to us so we can
Well, it'd be
make
good
sure.
for us to know so we can let the
That.
public know that Board of Health
Right.
agrees with
Public
this
needs to
program.
know.
I agree with the program. I like the program, but
Yeah,
if
it
we
sounds
know
a
to the
little,
public,
it sounds
yeah,
a little off until you start to see the data. And
Exactly.
the data is very effective. Nancy's very good at that.
it'd be good for
Yeah.
us to have on record that we approve, I
Right.
think. Yeah, okay.
I
Thank
just
you,
want to
Ben.
say one more thing, and, oh, I'm sorry, Susan, you go. I mean,
Susan has her hand up.
Yeah, I just wanted to give some information to all of you. A group of 5 of us health professionals in Wellfleet responded to a request from Chief Hurley and Chief Pauly many weeks ago now, and we have set up something called the Wellfleet Well Line for anyone who wants to call to have someone with medical background but not practicing clinical medicine on this call help figure out where the best resources are for the person who's calling. And Hillary's been extremely helpful in posting this on the town website and on the police department website, Facebook page, and we're slowly getting the word out. We've gotten a handful of calls, and we're hoping to get more. We are going to provide a one-on-one conversation over the phone. We're going to provide an ongoing buddy system over the phone, and we're providing a weekly Zoom support group led by a clinical social worker practicing her licensed trade. So that will actually be a therapeutic group. The rest of it will be just to help people figure out where to go. And the calls we've gotten so far have been extremely appropriate, and we're here to help. So just to let you all know that.
Well,
Right
thank you
here
very
from
much.
me.
Excellent.
I just want to say one thing. I'll make it very brief. Just as far as feedback from the town, I think what I have heard so effectively from many businesses is the partnership that Chief Hurley and the Department of Health have gone into in effectively educating and allowing businesses to open and be imaginary and innovative in order to have a fairly successful season. And I think that's something that we as a town need to be recognized and congratulated for, all the departments, because they've gone out of their way to help businesses successfully have the best season they could possibly have in this COVID summer. You know, when I look at the concrete stanchions and I know that Chief Pauly and Hillary have gone around to every restaurant and helped. I just want to give them a kudos from Janet Q. Citizen, that you did a great job. Thank you.
All right, nice
Well,
job.
my children
That's
just
the
spent all their
second-
savings in Wellfleet, so
That's good. That's a
yeah,
good
it's
thing.
great.
Send them up. Send them down. Send them down.
All right,
All
so,
day.
sorry, so we got nothing else to think about or talk about right this, well, lots of things to think about, but nothing to address at this moment. So I would like to ask for a motion to adjourn the meeting.
I put a motion in place to adjourn the August 12th meeting of the Board of Health.
All
I
right,
second.
all in favor?
Aye.
All right then. All right, thank you for everybody for coming.
Thank you,
Bye,
Ken. Thank
guys.
you.
Thank you.
Bye-bye, guys. Thank you for everything. Okay, bye-bye, Ken.